Hello, Psyche listeners. This is Samantha Sweeney with the Medical Affairs Department at Otsuka. I'm joined today by Dr. Stephen Chen, who is an Associate Professor and Associate Dean for Clinical Affairs at the University of Southern California School of Pharmacy. And he's a nationally recognized leader on expanding the scope of pharmacy practice to improve patient outcomes while saving healthcare dollars. Dr. Chen, thank you so much for joining to talk about the important role of community pharmacists in COVID-19 testing.
For having me. Really appreciate it.
Thank you. So jumping right in, on April 8th, 2020, the Department of Health and Human Services issued a statement that authorized licensed pharmacists to order and administer COVID-19 tests. And this is a move that was applauded by multiple pharmacist organizations. Can you comment on why this is significant, and have there been any precedents?
Yeah, it's a great first question. This is a tremendously unique thing that occurred at the federal level. I think most non-pharmacists, which I think is much of your audience, don't know that pharmacists are not officially recognized as healthcare providers under the Social Security Act. Way back in the 1930s, pharmacists were doing pretty well making medications. There were manufacturing or companies that were cranking these out, and back in those days, pharmacists were in their pharmacies literally compounding drugs, and it was an art, it was a critical need, and for whatever reason, there seemed to be no interest in the pharmacy community in being recognized as healthcare providers. But we paid for that because, fast forward to today, and now because we're not officially recognized, neither Medicare or Medicaid have any lines to pay pharmacists for clinical services. And so we've struggled with securing clinical roles. I think because of that background, to have something like this happen at a federal level that authorizes pharmacists to provide a clinical service is pretty unprecedented. So to your point, something like this is not common, and I'm thinking that I can't remember actually a time something like this big has occurred. And obviously the circumstances are pressing. We need pharmacists to step up and be part of this solution for the pandemic that we're in. So I'm glad that common sense prevailed and we were able to get these authorizations. So moving forward, I'm excited to see how the pharmacy community steps up and takes advantage of this opportunity.
Absolutely, same here. So now, not everyone who's listening may be as familiar with the expertise and training that pharmacists have. So can you discuss what makes them particularly well suited to step in and help manage this disease?
Yeah, that's a great question. I think people would initially balk at the idea that pharmacists are managing a disease. So let me kind of reframe what that means. Pharmacists trained, like many other healthcare professionals, for quite a long time to get a doctor of pharmacy degree. That training involves training side by side with physicians, nurses, other healthcare professionals. So, in order to get a doctor of pharmacy degree, you need to have clinical expertise, specifically in managing medications. So that's sort of the unique aspect that pharmacists bring to the table that other health professions don't have. Yes, other professions learn a little about medications, but not to the depth and breadth of what pharmacists learn. In the case of COVID, there's so many aspects to this that are so critical. First of all, as you know, we struggle with testing and the ability to administer and give enough tests to people who need it or want it. Pharmacists have done testing for a long time in a variety of conditions, out of community pharmacies, out of embedded practices. I'm not sure if people know that pharmacists already test for strep and flu infections in pharmacy. So this is really not a different process for them. They're well suited to step up and be part of the testing process. And then something we may talk about later is we're talking about a disease that has greatly magnified and accelerated the impact of common chronic conditions. Right? So if you have hypertension, diabetes, asthma, these very common diseases, and you have a COVID infection, your likelihood of being hospitalized or dying goes up tremendously. Pharmacists are very well suited to better manage those medications, make sure patients reach their chronic disease treatment goals, and make them stronger so they don't end up being frail and more prone to the adverse outcomes of the disease.
Thank you. So the topic of COVID-19 testing has been top of mind for many people. In your opinion, as a healthcare professional, what would be the likely effects of widespread community testing, not just for the active infection, but also for the antibodies, if that became more commonplace?
Well, you're hitting on the soft spot what we have right now, right? So everyone's excited about trying to lift the lockdown all over the nation. And the thing we haven't figured out is testing, right? There are four key elements to re-entering society, getting out of this lockdown, right? One is hygiene, the other is distancing, the other is masks, and the fourth is appropriate screening and testing. We haven't quite gotten there yet, right? So we need, to your point, some level of widespread surveillance, which includes not just screening for symptoms, but because patients are infectious before they manifest with symptoms, we do need some level of widespread routine testing. As I've said many times to other groups, there's no way that this can be done in the current healthcare system. You have 5,500 hospitals across the nation, you have 5,400 emergency rooms, and then 67,000 pharmacies across the nation. You have 91% of the US population living within 5 miles of a pharmacy, and in urban areas that cuts down to less than 2 miles. So access to a pharmacist, to a healthcare professional, who, as I said before, has the skills, has the expertise to do proper training, to educate patients should they test positive on what to do depending on if they have symptoms or not, and then to eventually, if we get a vaccine, administer those vaccines, and then perform contact tracing or be a part of contact tracing to make sure that anyone that patient encountered gets tested or screened and further quarantined, et cetera. Those are critical elements that we need to have in place in order to lift the lockdown. Your second part of that question was testing for antibodies. I'll be honest, that's a bit of a black hole right now. We have tests that are getting better and better at testing for IgG and IgM specific to COVID. What people don't know yet is what is the effect of having antibodies to COVID. Does it mean you have full immunity? And if so, for how long? Is it partial immunity? We don't know any of these things yet. And so we are at USC are launching a study, we're trying to launch a study where we're going to test that question out for about a year and find out over the course of a year in our own school of pharmacy population, what are the effects of those antibodies on over time.
Okay. Well, thank you so much for that, Dr. Chen. So now, safety is first and foremost, right? It's so important to have that top of mind as well. So what precautions would pharmacies need to take to become safe testing sites?
Pretty important, as you just said. I think that pharmacists need to keep in mind first and foremost that when you're in an enclosed space, the risk is higher. And so I think most pharmacies are trying to figure out how can we take this testing outside, preferably in a drive-through type format. But if that's not available, since some pharmacies don't have the capacity to do a drive-through setup, at least a tent or some similar sort of outdoor method. That's probably the smartest way to go, I think, in terms of minimizing risk to employees. The second thing, which is great, is that with these newer tests, they're self-administered. So let's say you have the ideal situation, you have a drive-through setup, your patients drive in, with the pharmacist is completely gowned in PPE, they receive the test kit, the patient self-administers a swab. And by the way, if you didn't hear this, there's a study that came out just the other day that said that salivary test samples are more accurate than the deep nasal swab. So it gets even easier, right? Patient self-administers, and they're pretty much done. If they're doing a rapid test, they can park on the side, wait between 5 and 15 minutes, and get the results. So I think all those elements have to be in place. The safety of the patients to protect themselves, other patients, and the pharmacy staff, and just a process that works within PPE, like I said, is absolutely essential.
Thank you. So besides ordering and administering tests, in what other ways could pharmacists help manage the pandemic overall?
So referring back to what I said earlier, I think an under-recognized critical need in light of this pandemic is that we need to make sure our patients with common chronic illnesses are well controlled. Right? Before this pandemic started, we were already last place of all developed countries in terms of healthcare quality. We don't do a good job managing hypertension, diabetes, asthma compared to other nations. And that's making our patients highly vulnerable to this condition. Before we needed hypertension, the consequences of it could take years to manifest. Then you have hypertension, you get infected, you could be dead, you could be hospitalized within a couple of weeks to a month. Right? Those are very staggering concerns. So pharmacists, I think, have a critical role and the expertise to make sure that patients receive optimal medication therapy that drives control of these chronic conditions so that we can improve the resilience of these frail patients to this infection.
Well, Dr. Chen, thank you very much. We're at the end of our interview for sharing your expert advice, and a big thank you to our PsyQ audience for listening. Take care.
Thank you.